and I am the office manager and patient concierge here at Rejuva Stem Cell Clinic. But I wanted to introduce you to two very amazing and wonderful people. First, our CEO, Dr. Mike Tillman, and our guest of honor today, the amazing and wonderful Lorna O'Connell. And not only is Lorna just one of our best friends, she is also one of our most fantastic patients with a really great story. So thank you both for being here, and Lorna, thank you for joining us. We share your story all the time, and I would love to hear it straight from you.
It is an honor to be asked, Lauren. I love you. I love Dr. Tillman. I love Rejuva Stem Cell Clinic. And my story is this. About 13 years ago, I fell and broke my left hip during Hurricane Fran, trying to be a hero and rescue a stray dog. At the time, it cracked the upper femur, and so at the time the doctor only pinned it. Over the course of 4 years, it underwent necrosis. I finally had a full hip replacement in the left hip 4 years later. But by that time, there had been compensatory damage to my gait and my spine, which really affected my right hip. So over the course of the year since 2008 until now, I have been seeking every solution short of blowing my brains out to stop the pain, to try to alleviate the pain and also to avoid another full hip replacement. I did not want to go through that again. It was horrible, absolutely horrible. And I became a little bit addicted to pain pills, while trying to recover from that. And there are such bad side effects to that. I won't get into that, it's a little bit personal. But anyway, I have looked at the vibrating machines. I've looked at water therapy. I've looked at so many different things, steroid injections, which are okay, but they go away. They don't have lasting effect. And then, because I'm a sponge for knowledge, having my degrees in journalism, I was looking around and Googling about stem cell therapy, and I had heard about IV transfusions of stem cells. A girlfriend of mine who has lupus, she was talking about that. And I happened to come across your clinic. So I asked a friend, and he told me about you, about Rejuva Stem Cell Clinic, and that you are so unique and that you deliver stem cell injections to the joints, any joint in the body, like the knees, the hips, the shoulders, even the back, which we'll talk about that. I've got an L4, L5 that's probably into. Since that day, I cannot tell you, it's nothing short of miraculous. If anybody is looking for an alternative to surgery, painful, risky, costly surgery, and undergoing general anesthesia, especially at my age, when you get older, the risks are even higher, and you kill brain cells over time. If you can afford to do this, if you can do it, do it. Your knees, your hips. I just can't tell you how this has changed my life. Not only has the pain subsided, 24/7 pain, I'm not taking any medication to alleviate the pain anymore. I'm sleeping soundly at night. And also, my adorable disposition is back. I'm not grumpy. I mean, I used to be this strained with that smile on the face because being in show business, you gotta be able to shake hands, kiss babies, and the whole bit, but it was so grueling, and I would fall into bed exhausted at night from the pain, because pain just completely zaps your energy.
Patients are not able to do the things that they love to do anymore because they're in pain. Was there anything, I know you've always been just an active, upbeat, working person, but was there anything that you weren't able to do physically, like any exercise or any hobbies beforehand that you're able to get back to? Was there anything that...
Well, the walking is incredible. Now I'm walking more. I used to swim a mile a day before I broke the hip and then I had the replacement. Right now I don't have access to a pool, but I want to get back into doing laps. If I can't do the crawl, then I'll just do exercises. So I'm doing that. I'm wearing heels. I'm dancing. I went to a nightclub a couple weeks ago, and I was actually not afraid, and I had little heels on. I was not afraid to get up and dance. I don't dance like the kids do, but I danced. And it was amazing. It was thrilling that I was able to do that because I haven't danced in years.
That's exciting.
It was so cool. It was wonderful.
That's great. That's awesome.
Yeah.
Another question that a lot of our patients have is, they might have heard about this, they're learning about stem cells. they aren't sure what the process is like. And so can you tell us a little bit about how the whole process was, the beforehand, everything from the consultation to how you prepared for the treatment and maybe the day of treatment?
It was so easy. All I did was, I think I had an x-ray or whatever on the hip, whatever you wanted me to get. And then I came in and spoke with you, and it was a free consultation. You guys are like family. You're so wonderful. You answered every single question. There was no pre-op or anything like that. I didn't have to drink anything like, stuff. I just came in. There wasn't any pain. Tony explained to me that he didn't put any numbing anything on the area because that would kill off some of the little baby stem cells and stuff. I gotta tell you, my expectations were like, well, let's see if this works. I'm not sure, but if it doesn't work, then I guess I have to go under the knife. It was painless, and I got to wear a cute little Band-Aid afterwards, but it was just, you know what it felt like? It didn't hurt. It felt like if you've ever had a steroid shot in any joint in the body, it just felt like it was like something was filling up. It felt something was taking up some room, and it felt a little warm, as a matter of fact. But there was absolutely no pain whatsoever. And I wore that cute little Band-Aid, for a day or so. And then, within a day or two, it suddenly hit me, you know what? I don't hurt like I was hurting. I'm not kidding. It happened that quickly. Because I know you explained to me that all the stem cells that I received, they would replicate themselves on a daily basis, every single day. Because they're brand new stem cells, unlike my old stem cells. Now, people have told me about, oh yeah, well, I had that was that PRP, and it never worked for me. But it wasn't. Nothing like that at all. PRP it would have been my own stem cells, which are 6 or 7 years old. So they don't replicate like they used to, right?
Yeah.
I've learned so much.
And so now, and I know we've sent you to get some follow-up x-rays, which you said are on Friday, I believe.
Friday.
So we're looking forward to seeing how they compare to your previous x-rays. And usually at that 6-month point is really where we say we're hitting the full stride of the results that you'll feel. And I know you said you started feeling some positive improvement within a couple days. After the treatment, those first couple days to a week to a month, how was your progress? Did it go up quickly? Did it plateau at all? How's that 6 months been for you?
It keeps going up. Now I have to say there's some days like when it's humid and stuff, the pain comes from my lower back, the L4, L5, we have to talk about that. But my hip is fabulous, and it's not that noticeable. It's very sneaky, the way you just start to feel better. It's miraculous, and I'm not taking any medication. There's nothing that I'm putting into my body. This is just doing its work, and I did not plateau. I think even today, I feel better than I felt even over Christmas in Chicago. Seriously, I think that they have still been doing their little job since then. I really do. I really didn't plateau. Now, I know that you said after 6 months or so, and it's been about 6 months, maybe 6.5 months. So we'll see. I cannot wait to see the before and after, because I love those, before and after pictures, I can't wait. And I know that there's going to be a lot of tissue and cartilage showing there that was absent 6 months ago. I can't believe it. I really can't. I'm so blessed. I'm so blessed I found you guys. I really am.
And that's a good question too, because it's interesting to see a patient make that decision, whether they already had made that decision when they walk in the door, or they make that decision while they're here, maybe when they go home and talk with friends and family. Was there kind of an aha moment for you at all when it just kind of clicked for you, this is what I'm going to do, I'm ready, I'm confident? Was there any one thing that happened or anything you learned or heard that made you confident?
Well, I love to learn about medical modalities, 21st century medical modalities, and I'm a big proponent of, homeopathic, natural remedies, whatever. I've long subscribed to that. If there's any way to avoid, I'm not a vegan, I'm not, crazy about it, but I do believe in naturally, having the body naturally heal itself. And stem cell therapy was like, yeah, this makes sense. We are, stem cells, and if I can get some brand new little baby stem cells to do that job, because there's nothing artificial, not surgery, not anything that I had ever heard of before or had ever investigated on the internet or by word of mouth that ever compared to this. And I am so glad that I was able to do it. Seriously, it's a whole mind, body, spirit adventure. I mean, it healed my body. It cleared my mind. I'm not so tense anymore. I'm not so tired and exhausted anymore. And my spirits are so lifted. It's just, talk about holistic approach to therapy rather than going through surgery. It's just amazing. Absolutely amazing. So
It can be life-changing.
it was like totally life-changing. And even lifestyle changing as well. I'm dancing, baby. I'm dancing. Like no one's watching.
We have a lot of people who come and ask questions and they're doing their homework, they're doing their research. We can provide a whole lot of science and a whole lot of answers and a whole lot of research, but there's also that you have to believe and you have to trust it and you have to put your faith in the medicine and in the science. What would you tell somebody who maybe we've given all the research and all the science to, but they're still considering it, they're just not sure if it's the right thing for them? What would you tell somebody who's considering it?
I would say go for it. If you can do it, what are you waiting for? The only thing you have to lose is more precious time of living the life you want to lead without pain. Seriously, I believe that stem cell therapy is the wave of the future. It really is, because it's natural. Like we said, it's holistic. I don't know why people could not make that decision. I'm adventurous. Some people are just afraid of change, and perhaps they would like to hold on to that. But I didn't want to live in pain anymore. I wanted to get rid of pain, but I wanted to do it in a natural way that wasn't invasive and wasn't going to... When I had my hip replacement, I was on a walker for 3 months. It was, and the pain pills and then the subsequent pain, the compensatory pain that came after that. Do not hesitate. If you can do this, if you're still standing on the precipice of indecision, jump, go for it. What have you got to lose? Be adventurous. Grab your life back. Take your life back. And this is what this has done for me. Seriously, I got my life back, baby. I'm on the hunt. No.
I love it. Are there any negative side effects that you've noticed at all, or?
None. There's not one negative side effect that I can think of. Not one. Absolutely not one. I had no reaction, adverse reaction. None. I can't think of anything. Yeah. So it's just I'm like a new person. People and I have a girlfriend in Wisconsin, and she had a knee replacement a year before I was able to get my stem cell injection. And she is so unhappy. And she said, "Do you think that I could get a stem cell injection?" I said, "Honey, not with that knee replacement. You can't. You're not a candidate." So, if any of you are thinking about, well, let me do the hip replacement or the knee replacement first, and then I'll check it out. Don't. Do this first. This is because once you have the metal in your body, like I cannot have a stem cell injection in my left hip, and more's the pity. If I had known about you, if this medical science technology had been available back then,
Well, when did you have your hip replaced? How long
Oh,
was
the
that?
whole hip replacement was in 2008, and I understand that it would not have regrown the femur, but it was just the blood flow was not getting up to the top of the femur when I snapped it. So anyway, but if anybody if you can avoid the surgery, check this out first. If you're a candidate for this, do it. I don't know why anybody would hesitate for a moment.
So, Dr. Tillman, Lorna mentioned that, one of the things that was most important to her was just getting out of pain and living the life that she wanted to live and be active. Do we see a lot of patients in here that have stopped doing what they love doing, and what tends to be the process with them getting back to their activities after a treatment?
Yeah, I'd say that there's a pretty high percentage of patients that don't make the move to investigate this until the pain or discomfort is truly interfering with what they love to do. Typically, if somebody's a golfer, a tennis player, a jogger, or any kind of activity, or maybe they can't even play with their grandkids the way they used to, and the pain is interfering with that, that's when they come in. There's a lot of misconception that patients come in when they're in pain. There's actually been studies done that is 10 years from the onset of pain before a patient actually seeks help for that.
And then after the treatment, is it the same kind of downtime as like with surgery, or are they able to pretty much get back to living their normal life?
With stem cell treatments, it's a simple single injection into the joint where the patient leaves doing exactly what they were able to do beforehand. And of course we give recommendations based on their current activity level, and is it damaging to the joint, and is it going to interfere with healing of that joint. But generally, if they walked in, they're walking out.
Now, when somebody does show an interest in stem cell treatments, maybe like Lorna mentioned, she heard about it either from a friend or on the internet or starts hearing a buzz, how do you guys determine who's a good candidate and what their treatment plan should be?
The process is, it always starts with a consultation and understanding the patient's medical history, how they got to where they were. We do image review if they have MRI or X-ray. If they don't have that, typically in weight-bearing joints, we order MRI. And some joints we use just standard X-ray in combination with diagnostic ultrasound for musculoskeletal conditions. So we go through that process and we evaluate whether or not the patient is a good candidate, and certainly we rule out certain patients based on their medical history or their current medical status, but that's typically a very small number.
Now, one of the things that Lorna mentioned also as something that she had heard about, and I know a lot of folks have tried this in the past, she mentioned PRP, or platelet-rich plasma. How does that relate to stem cells? Is that similar or different, and if so, how?
PRP is very healthy and is very regenerative. When you pull out the platelets and you separate out the platelet-rich plasma, there are no stem cells in there, but there are a lot of healthy growth factors, proteins, cytokines, growth factors that can help to heal damaged cells. But the difference is when you have live stem cells that are living and going through mitosis and a doubling procedure, and they're participating in what's called paracrine signaling, which is a cell-to-cell communication. See, damaged cells or inflamed cells will always send out a cry for help by releasing chemicals that let other cells, particularly stem cells, know what it needs, and in response to that, those stem cells receive those and they communicate back with the original cell healing factors, again, the proteins, cytokines, and growth factors that cell needs to regenerate, repair, or regrow.
So what you're saying then is PRP does call in those proteins, cytokines, and growth factors, but stem cells do as well in addition to creating new tissue. So it's just a more powerful effect.
That's right. The stem cells, one researcher put it this way, getting a stem cell injection is like getting a PRP injection every day for 90 days.
Wow.
Wow. And PRP is your own blood. For instance, if you had done PRP on me, you would have taken my own blood, correct?
That is correct. It's taken from the vein. It's taken in the back. It's spun out to separate out the platelet-rich plasma portion. And but research has verified that there's very little to zero live stem cells in that product.
And stem cells are the things that rebuild tissue and cartilage, correct?
That's correct.
Okay.
Stem cells exist in our bodies in certain areas, more concentrated than others. Bone marrow is one of those places, and a lot of doctors go to the higher concentrated areas to pull out stem cells, bone marrow, so that they can separate out the stem cells. They're just two very different things. Platelet-rich plasma is regenerative, but it's not stem cells. When you pull out the bone marrow, that's actual stem cells, but that comes with its own set of problems and risks, and the stem cells may not always be as effective because of age, medications, other toxins like sunlight, alcohol, drug use, and even pathology can affect the viability of your own stem cells. And that's why we use umbilical cord derived stem cells. So we can separate out a very high number, rich supply of live stem cells to inject into a patient, and they're so much more prolific. And the way they multiply, their speed, their size is about half the size of an adult stem cell, of an elderly adult stem cell, and they respond very quickly to paracrine signaling.
How often, for instance, my stem cells, a 69-year-old woman, if you had taken my blood, how often do my stem cells undergo mitosis as opposed to umbilical cord stem cells, the brand new stem cells?
Great question. Stem cells from an older sept generation, 50, 60, 70-year-old person will go through mitosis every 4 to 6 days. In comparison, the stem cells out of the umbilical cord will go through mitosis every day. Every 22 to 28 hours, they can double. They have the ability to double.
So not only are you using more cells in a typical treatment using the umbilical cord cells, those cells also multiply quicker. So the
That's
time it
correct.
would take for the bone marrow or for the autologous cells to reach the numbers that the umbilical cords are doesn't even compare.
That is correct.
So it's just faster.
So
Just
that's
more
why I
efficient.
felt
Faster.
such a huge relief in pain so quickly,
That's
and
right.
have progressively felt better and more energized and more back to my old self,
Yeah.
you know?
And that's why we do this. I
Yeah.
mean, clinically, it's just the most exciting thing. And you said it, it's the future of medicine.
Yeah.
Now, Lorna's at this point, she's 6 months down the road from her treatment and has had really incredible results and is looking forward to the next 6 months and years after that. How long will those cells that we originally used in the body last, and for how long will those cells that come off of them keep doubling?
So the cells that we put in probably lasted around 90 days.
Mhm.
But one of the factors that they release are called stem cell growth factor. And stem cell growth factor stimulates and stimulates and helps your own stem cells to become much more powerful. A lot of researchers believe that this may be the most powerful effect of stem cell injections, is making your stem cells more potent and more powerful in your own body to rebuild tissue.
Not just in my hip, but could that be the reason why I didn't get sick in Chicago this year?
That's another great point, is that we know that stem cells, particularly umbilical cord stem cells, are highly immunomodulatory. And what that means is that when they go into the body, they boost the immune system. In fact, one of the only contraindications to receiving stem cell therapy is someone who's on immunosuppressive therapy, and that's because their doctors have them on immunosuppressants for a variety of reasons. Sometimes it could be they're on a transplant waiting list, or they have received a transplant. Often you have to suppress the immune system so that the body doesn't attack that foreign object.
Now, Dr. Tillman, Lorna mentioned that she had had a hip replacement in the past, a friend had had a knee replacement in the past, and that for somebody who's had a joint replacement, they're not necessarily a candidate on that side. Can you explain why that is?
Yes, stem cells only participate in the repair of native tissue. So if there's synthetics in there, it doesn't mean that stem cells won't help the native tissue that's still local. It hasn't been studied enough to know if there's enough benefit to outweigh costs and risk and that sort of thing. But I imagine at some point it will be studied. Maybe the prosthetics will even last longer if that's the case, but it just hasn't been studied yet, so there's no evidence that that's the case.
Interesting.
Now, on that same line, talking about joint replacements, Lorna mentioned that one of the things she would tell somebody who is considering this is to just do it, just trust it, just try it. And I know a question that you get often is, I've had X, Y, and Z in the past, am I still a candidate? Or if I do stem cell treatments, would I still be a candidate down the road for something else? On either end, would having a stem cell treatment be approachable or doable for somebody who's had maybe PRP or cortisone injections in the past?
Oh yeah, none of those things are contraindications or are would prevent a patient from getting a stem cell injection. In fact, it's a good idea to try less expensive, typical medical approaches in order to keep the cost down, because many times PRP does a decent job. You know, it's just not as typically as thorough as what stem cells are, but it's very reasonable to try things leading up to it. But I would say this, that stem cell before surgery in every case would be my opinion. The difficult part for some patients is that insurance doesn't cover it yet. And so while it's not cheap, we are very proud that our process, we've been able to bring the cost down substantially to other comparable treatments that are one-time treatments, like a LASIK surgery, for instance. You know, most joints are done for less than the cost of LASIK surgery.
Now, I know that stem cell treatments, umbilical cord stem cell treatments, are FDA allowed. They're not quite FDA approved, and we could always get into the reasons why with big pharma and everything. But can you explain a little bit about the differences between FDA approval and FDA allowance?
Yeah, so FDA approval is it's typically applied to medical devices that are very invasive, or drugs, medications. And so there has to be a certain amount of studies, animal trials, and then human trials that have to be documented, and there has to be, in their estimation, a reasonable risk versus reward quotient in order for them to approve a medication. But as we know, the FDA pulls many medications every single year following that process after patients begin having issues. The FDA right now allows us to do stem cell injections because, frankly, hundreds of thousands have been done, and there's very little to no side effects. There have been adverse events that are non-emergent: swelling of a joint, tenderness, a little pain following the injection, and very, very, very few emergent adverse events. And the risk versus reward is just astronomical.
Where do you get the umbilical cord blood? Does somebody donate it to you? Where does it come from?
Yeah, so the lab that we purchase our stem cells from, they have contracts with hospitals. And so if parents in the second trimester choose not to store their own cord blood, they have the ability to donate that cord for research, which is basically what we're all doing. And once that's done, then those parents and the cord tissue itself get tested just as if it were going to be a kidney transplant, say. They're tested for all communicable diseases through regulations in the American Association of Tissue Banks. They're tested for sterility, gram-negative and positive strains. They're tested for literally everything known to us before they're able to use those as donor tissue. And then the lab, in a very sterile setting with very expensive machinery, is able to process those cells and begin the cryopreservation process within 12 hours of a healthy baby delivery.
And what lab do you use? Where are they? Are they here in Florida?
We buy our stem cells from Livion, and they have the best reputation in the marketplace. We check them all the time because we deliver a lot of stem cells here. We get approached by a lot of vendors because there are several other companies out there, but we have found that they have the highest cell counts, which is important in stem cell medicine, and they have the highest safety due to the very low presence of certain components like HLA-DR or glycophorin A, which can cause adverse reactions.
So they're number one in the country, and they're the ones from which you get your stem cells.
I believe they're the largest in the world.
So these guys...
Because I know you know so much about stem cells, and you do a number of different educational seminars to teach other people and doctors about stem cells. Dr. Tillman, what about stem cells just excites you personally the most?
The clinical results, safety and efficacy. That's the thing that brought me into this business, and that's the thing that's kept me in this business. Safety and efficacy of stem cells, and the fact that it's natural. There's so few side effects. There's so few real issues with stem cell therapy. As far as I know, stem cells from the umbilical cord have never caused a single death. You know, just we looked up the other day, antidepressants kill 40,000 people a year,
Really?
and they're still on the market.
Oh my, OMG, I know.
And FDA approved.
And they're FDA approved, and your insurance will pay for it.
Interesting.
That's
Right.
another discussion.
Yeah.
That is a whole other discussion. Dr. Tillman, I have one more question for you. Have you ever been treated yourself with stem cells, or has anybody in your family? Is that something that...
Of course, myself, I treat myself. I've treated both of my parents, my mother's knee, my father systemically, but absolutely. I took my first dose before I ever even opened this clinic. Just one, I was excited to do it, and two, I just wanted to have my own story with it.
Now, that being said, because I was going to ask you if you would have your kids do it if they needed it, and I would imagine the answer is a resounding yes.
Yeah, 100%, absolutely. If they ever had a need, I wouldn't hesitate.
Great.
Is there any, oh, I'm sorry, is there any age limit? For instance, I mean, is this approved for children under 12?
Well, that's a great question, because the only approved stem cell therapies in the United States right now are for certain blood cancers for pediatric patients with certain leukemias, blood-borne cancers, and they use allogeneic umbilical cord stem cells to treat those.
Gotcha, okay.
So there's not, so you might see patients in their teens up through, is there an age limit?
Not really. I mean, it's not an age limit. Our expectations and the expectations we try to set for our patients, we temper those once they get into the upper 80s and 90s, but we still have had great success with patients that are 88, 89, 90, what do we have, 96, 94, and we've had success with those. And, you know, once we do the follow-ups, we're probably not expecting to see the same kind of tissue changes that we're going to see in Lorna, but we do expect to see positive cartilage growth and joint separation.
Well, this has been so wonderful sitting down with the both of you and being able to talk and ask a few questions. And I just want to thank you both for being here and for being honest with us about your experiences. And we're looking forward to seeing where this goes in the future. I'm so excited to be a part of it.
Oh, thank you. I love you both so much. Thank you so much. Oh, do it. This really will change your life. It changed mine.